For our COVID-19 update today, we have 14 new people who have tested positive for COVID in British Columbia, bringing our total to 2,694 people with COVID-19. That includes 917 people in the Vancouver Coastal Health Region, 1,386 people in the Fraser Health Region, 130 people on Vancouver Island Health Region, 195 people in Interior Health Region, and 66 people in the Northern Health Region. We have no new outbreaks in healthcare settings today, though we did have the one new outbreak that was identified yesterday, leaving us with 5 active outbreaks in long-term care. To date, we've had 560 people in the long-term care, assisted living, or acute care outbreaks that have been affected, including 341 residents and 219 staff. We also continue to follow a number of clusters in the community, in particular, we know that there has been a cluster related to the Coral Lake outbreak in Alberta, and that one is thankfully winding down. It is not yet over, but as we go through the incubation period, we're hopeful, if there's no more cases, that it will be declared over early next week. So we currently have 183 active cases in British Columbia, of whom 13 are hospitalized and 5 people are in critical care or ICU. We have no new deaths again today from COVID-19, and 2,344 people are now fully recovered. There are a few things I'd like to speak to today. We have spoken before about the many unintended impacts of COVID-19 on people across British Columbia, both positive and negative impacts. And we have seen people in BC come together in kindness and support for each other. But we've also seen tragedy. And as everybody knows here in BC, COVID-19 is not our only health crisis. This morning, the BC Coroner's Office announced 170 people in British Columbia died from overdoses in the month of May. I cannot express how difficult this news has been to hear. My thoughts and condolences go out to the families and friends of those who have lost their loved ones, and I share your grief. These are our brothers and sisters, our co-workers, our sons, our daughters, our friends, our community. And the extent and challenges of these crises that we are facing, both the overdose crises and on top of that, the COVID-19 pandemic, have really stretched our resources to the limit. What we do know about these recent deaths is that there has been a dramatic increase in the toxicity of the street drug supply here in British Columbia, and it is around the province. We are not only seeing people die in the downtown east side. This is the case across BC. In southern Vancouver Island, in the interior, some of the highest rates that we've ever seen of people being affected by the toxic street drug supply. We also know that COVID-19 is forcing all of us to stay farther apart from others. And this can be very isolating for some people and it makes it more able for them to hide their drug use from others, even if they might otherwise have reached out for help or been very careful about not using alone. We know that using alone right now is exceedingly deadly. The alarms of people missing have not been going off because we've been staying apart to do our best to try and manage the other crises we're dealing with. It has been particularly hard in these last 3 months because we had been making such progress in addressing the many underlying causes of the overdose crises. As we know, and I've said many times, it is a very complex crisis. There's no one single cause, and there's no one single magic bullet that is going to solve that crisis. But we also know that there are a number of things that we have put in place and that we are doing that we're working. And since the COVID pandemic has hit us here in British Columbia, there are a number of other things that we've put in place, including guidelines for providing people with pharmaceutical alternatives to the street drug supply. So things like diacetylmorphine and hydromorphone, and being prescribed those so that you reduce your dependence on the drug supply that we know is killing people in this province. And we know that that saves lives. We know that we've been able to increase the number of people who have been prescribed safe drugs by 150%. And those are not the people who are dying. We know that this being able to access a safe supply of drugs is one way that we can connect with people who use drugs. And it is connection that helps us address addiction. And it is connection that helps us overcome the many reasons why we use drugs. We know that it is multifactorial, that it has to do with pain, whether it's physical pain, psychic pain, whether it's emotional pain. And unless we connect with people, we don't have an opportunity to help them address those underlying causes. We know that overdose prevention sites and our supervised consumption sites work. We have not had any deaths at those sites. We know that drug checking works. It helps people to understand and take the precautions they need. We know that reaching out, that not using alone, and carrying naloxone work. We must all show the compassion that we have shown in addressing the COVID crisis and the understanding for our families, our friends, and our workmates, all people who use drugs, and help them know that they can reach out for help. They can talk about this, that we have supports. We can help you. We know that as well the safe housing that's been provided with the appropriate supports for many of the people who have been homeless, who've been in some of the very dangerous encampments, are also working to support people. Addiction and substance use are complex challenges, and as I said, they're rooted in pain. We must eliminate the stigma and shame that leads people to be afraid to reach out, to tell their family, their friends, about their drug use. And we must all do our part to protect ourselves and our communities and our loved ones. Eliminating stigma and shame, a large part of that problem is around people being afraid of being put in the criminal justice system. And I have called for this before. We must look at alternatives to the criminal justice system to support people in getting the assistance they need. We have shown what we can do to look out for one another in COVID in BC. And we know that the things that we are doing are saving lives. Today, a public service announcement has been released to let people know that support is available for you and encourage you to reach out, to connect. Call 811, talk to your provider, find a safe prescription alternative to street drugs. Don't use alone. Have a buddy, have a system. Try the app, the Lifeguard app, or call 911. Know the signs in your family and your friends. And check up on your friends. Check up on those people, those workmates that you have that you may not be seeing as often. This is another time that we need to, while physically apart, connect with each other and support each other. There are two other issues I want to talk about. One is that we've made some revisions to the order, the public health order around restaurants, including this is, as we've said, we will update our orders as we need to, as we get some more experience. And the environmental health officers and inspectors and WorkSafe BC have been working with the restaurants around the province to understand the issues and get some clarity on the things that were working and weren't working with the previous order. So instead of a blanket 50%, what we now are requiring is that every restaurant, pub or bar has to identify a number for their capacity that includes the patios. And this was one of the complicating things. As you're expanding your patio, how do we know what number to use? So it will be done in collaboration, and we'll have a defined capacity that will allow us to understand how better to enforce the rules. It also clarifies restrictions on the use of barriers, and those have been very effective in a number of places and have allowed some of the smaller local restaurants to open. As well, it puts in restrictions around self-serve areas and buffets that reduce the chances of transmission, and identifies some of the choke points in restaurants, and puts requirements for measures to be put in place so that people aren't congregating on the way to the washroom, for example. So these updated orders were posted last night, and the team at WorkSafe at BC-CDC and our public health inspectors will be working with the restaurants around the province to make sure that they get implemented. I also want to talk a little bit about some of the announcements that came out about the NHL. There has been much discussion and commentary about the NHL and the potential to resume the season. But like the Premier and many others, I also think bringing hockey back to BC would be a very good thing. But let me be very clear. There are no exceptions to the rules or the public health guidelines that are in effect here in BC. And in no way will we compromise all the work that we have done and the health of British Columbians for the NHL or any other group. The NHL has provided a proposal for consideration by federal and provincial officials, and we have reviewed that. And let me also be very clear, this is not for today. The proposal is for potential for some time in the future, late summer into the fall. I have reviewed that plan, and it exceeds the requirements that we have in place even today, and it meets our criteria for protecting our community without compromise. Teams would have no contact with the public, with no spectators, and no families. So it is the concept that I have said meets our criteria is teams that are in small pods of less than 50, that are in what we would call a household bubble. So it would be very similar to somebody coming back to a household here in British Columbia. They would also be subject to intense screening and testing for the entire time. And it is not just a 14-day period of time. If Vancouver were picked as one of the hub cities, there would be a period of several weeks, and they would be in this team bubbles for that entire period of time. So I would absolutely consider any other proposals that met that very high standard that this proposal did. And so I have given my, we've written a letter to Ottawa based on this and based on the understanding that we would have more opportunity to discuss it as we move forward and as the decision was being made. So this needed to be done at this time for the NHL to make their decisions, but we would, of course, the resumption of games, and again, without spectators, would be dependent on our progress and dependent on my assurance that these extreme measures would continue to be put in place so that the health of safety of everybody in British Columbia, which remains our number one priority. So we are still in our monitor, manage, and modify. It's the key to managing COVID-19 right now, keeping our communities safe, and protecting the ones we care for most. We have shown in BC that compassion, support, understanding work. They're what get us through this crisis. And they're what we need to show not only to our communities for getting through COVID-19, but also to deal with people who use drugs and supporting our communities through our overdose crises. This is the time, again, and continues to be our time, to be kind, to be calm, and please be safe.